Am I gonna turn around and desert you? Never gonna give you up. Never gonna say goodbye. Never gonna turn around and desert you. Never gonna turn around and desert you. Never gonna give you up and never gonna say goodbye. Never gonna turn around and desert you. Say we've known each other for so long. I'll never reason why we're wrong. I just wanna tell you how I feel. Because all I know, so I say goodbye. Never gonna sit around and desert you. Leave you up. Around it. Never gonna you on. Yeah. Let me get to know you, see you. With the rival storm. Yeah. Fire Babylon, fire Babylon, as a fire Babylon. Welcome, my people, we call it mental slavery. On fire Babylon, at your place, so I hear you say, fire Babylon. Hey, welcome to the channel. Who is watching? Who is here watching? Okay, welcome to music. Life is a flower. If you are watching, welcome to the channel. We want to talk about hormonal imbalance and fertility. Hormonal imbalance and fertility. That's what we want to talk about. So everyone who is here, welcome to the channel. Feel free to ask any question as I'm preparing some things here. Yeah, okay. As I'm preparing some things here, I'm not finding what I want. What is happening? Welcome everyone. Welcome to the channel. As you log in, just know we want to talk about some issues. We want to talk some specific issues. We want to talk about family planning and fertility. Finding donor. Hi. How is the going this evening? Where you are? We want to talk about hormonal imbalance and fertility issues. Someone asked, we talk about hormonal imbalance and fertility issues, and that's what we want to discuss. So as you get in, feel free to ask any question. Feel free to ask me anything that you feel is important. Finding donor. I was setting up some good. I was setting up some materials for listening and feeling. So fertility issues. Fertility issues. What is gonna anyone who is having any question, you can ask my friends. Welcome to everyone watching. Everyone watching. You're gonna ask any questions that you have. No worries, no worries. Fertility issues and hormonal imbalance. We want to talk about fertility issues and hormonal imbalance so that we can know how fertility issues affect you. The background is by Little Sister, Fire in Babylon. Fire in Babylon. Fire in Babylon. Okay, Fire in Babylon. So if you are coming in right now, this is Benjamin the Wise Guy, and we want to talk about hormonal issues and fertility issues. So listen to that. Welcome to the channel. If you are new here, let me see you in the chat. If you are new, please text to the chat. Let's check you in the chats if you are new. Here we talk about medical issues. So I talk about medical issues. Grass fire. It is called Fire in Babylon by Little Sister. Fire in Babylon by Little Sister. That is what you are listening to. Fire in Babylon. So let's talk about hormonal imbalance and fertility issues. Hormonal imbalance and fertility issues. Hormonal imbalance means the body is producing too much or too little certain hormones that regulate reproduction. You see, if you are watching, please, and you have not subscribed, check if you have subscribed. Let's go together and like. If you have a question, you can ask on the chat. The chat is open. You can ask there any question that you have, so that we can know how to help each other and mingle here. So guys, hormonal imbalance is something that is disturbing so many people, and mostly it disturbs women. Hormonal imbalance mostly disturbs women. And what is hormonal imbalance? Hormonal imbalance means the body is producing too much or too little certain hormones that regulate reproduction, and these hormones control what? They control ovulation in women. They control sperm production in men, menstrual cycles, and sexual functions. And also they maintain pregnancy. That is what is called hormonal imbalance. When hormones are disrupted, fertility can decrease or pregnancy may become difficult. When hormones are disrupted, fertility can decrease. The music is overriding my voice. Oh, I've stopped playing the music. Now we can talk, and we hope you are getting me right now. My voice is okay now. Yes, my voice is okay now. Now let's talk about main reproductive hormones, because Hormonal imbalance, you have said, is a problem, means that it is producing too much or too little of certain hormones that regulate our reproduction. You see, these hormones control ovulation in women, sperm production in men, menstrual cycles, sexual functions, and pregnancy maintenance, and also pregnancy maintenance. When hormones are disrupted, fertility can decrease or pregnancy may become difficult. So what are main hormones of fertility? The ones that we say hormonal imbalance, you see, they are those ones that specifically are meant for fertility. The specific ones that are meant for fertility are these ones. The main ones that are meant for fertility are follicle stimulating hormone from your pituitary in the brain. That one, when it is produced, its function, stimulates growth of ovarian follicles. The ovary, the follicles that holds a lady's eggs, it stimulates them. You get from your brain, it is removed, sure, and then it goes up to through the blood. It goes up to through the blood, and it goes to the follicles of your ovary down there. So when it goes to the follicle of the ovary, what does it do? Helps egg maturity. The eggs of a woman to mature, to be, you see, so that they can come to ovulatory state. You know, if you have any question about hormonal imbalance, please ask. The chat is open. So follicle stimulating hormone goes down there, stimulates the eggs. You see, when it stimulates the egg to be mature, and also it promotes estrogen to come. Estrogen is the hormone that makes a woman be a woman. It is the one which makes a woman. Hi Benjamin and everyone. Marcia, thank you so much for logging in. Today we are talking about hormonal imbalance and infertility issues. So when it has made those eggs to be fertile, and estrogen to come out, what happens? If you have it and it is low, you will have poor development of your follicles. I like drawing so that people can understand. Someone told me we need to talk about this topic. We need to talk about infertility. Why are people infertile? And when you go and look at them, they have everything. So let me draw the follicles. The follicles are like this. The follicles of your uterus and how your uterus works. You get? So this is when it is produced. What I'm drawing right now will show you. Will show you what I mean. The follicles. You know, the uterus of a woman is like, it is shaped like a love. A flower that is like a love flower, you see. So the uterus is like this, it's like that, you see. So this is what I'm drawing right now. Let me just show you. Let me show you the uterus. We are talking about hormonal imbalance and fertility issues. Your uterus looks like this. It looks like a love flower, right? Look, uterus looks like a love like this. So these are the follicles. These ones here, the ones that are looking like hands this side. So what they do is, the follicle stimulating hormone from your brain, it comes and makes these flowers to be fertile, so that they can mature on holding your health maturity of the egg. Give it enough estrogen that will make you have a mature egg through, see, these are the flowers. So that hormone that is produced, that is the work that it does. So if you have high follicle stimulating hormone, you get ovarian failure. reduced ovarian reserves, and seen near menopause. Near menopause, you get that is so high, and it destroys the follicles. So when it destroys the follicles, what happens? You start having imbalances. You get low follicle stimulating hormone. You will have an ovulation that is irregular. Poor follicle development. These follicles will not develop well, the ones that are holding your eggs, and you will have irregular ovulations. You get me right? Sir, that is good. Now we are understanding and going on so well. That is one of the hormone that starts to be released when a woman is in the cycle, follicle stimulating hormone. Before ovulation, it is released to prepare the follicles to help mature the eggs and to release estrogen. You see? So that is one factor. Let's go to luteinizing hormone. So follicle stimulating hormone is one, and then there is something called gonadotropin releasing hormone. That one is the one that releases from the brain. It releases follicle stimulating hormone and luteinizing hormone. So there are two. Luteinizing hormone, LH, causes release of the egg. When you are releasing the egg to be fertile, suppose corpus luteum formation. Corpus luteum stimulates progesterone production, and also what it does, it helps maintain pregnancy when pregnancy occurs. Production of progesterone. So when a woman is pregnant, progesterone is high, and progesterone supports pregnancy. But when estrogen is high, it's the reverse. See? So luteinizing hormone is a very important hormone. When you have an imbalance of luteinizing hormone, what will happen? You will not have ovulation. Because no progesterone, ovulation is not there. There is no anything that is supporting the egg to come out. Luteinizing hormone signals the egg to come out so that it can go to be implanted in the uterus when a conception has happened. You see? So those are the very important issues that we can talk about when it comes to hormones. You see? So if you have low luteinizing hormone, you start irregular menses, because one, when it is released, when luteinizing hormone is released and it is preparing the egg from coming to be implanted to the uterus, it is preparing even the cycle. When progesterone is coming out, there is no menses, because the thickness of your uterus, the uterus becomes thick and it doesn't come out. Menses are the uterus wall coming out and flaring out, the new one coming up. But when progesterone is high, it will not do that. Why? Because it is preparing for the implantation of the baby, the zygote, into your walls. So no, there is no menses. There will be no menses. But there will be no menses. So let's talk about common in polycystic ovarian syndrome. Because if you have polycystic ovarian syndrome, where estrogen goes up, and then you start having more imbalances, you start having more problems of progesterone. So you start having irregular menses because there is no enough progesterone. The cycle is destroyed. Estrogen is produced by ovaries. It regulates menstrual cycles. Whatever that you hear, estrogen is produced by the ovaries. ovaries here that are here, the ovaries. So the ovaries, when it is if you have any question as we are talking about these things, please ask. If you are a new person in the platform and you want to ask, let us know where you are. Don't go without hitting the like button. Hit the like button. If you are a new person, tell us where you're watching from. Relate with my friends at the chat. Relate with my friends. Be one of us. Oh, Betty is here. Hey Betty, how is the going? How are you doing? I hope you're doing fine. So today we are talking about hormonal imbalance with what? Infertility. So welcome all ladies, welcome all men. Let's get to know how these hormones are like. So you see, estrogen is produced by the ovaries, the eggs and the ovaries, these two. So when it produced, regulates the menstrual cycle, thickens the endometrium, and supports reproductive organs. You see, very important function to get. Yes, 6. Stans has given me a 6. You see, Stans kitchen, you've made me salivate in your life. That was so sweet, man. That was so sweet. So welcome, my friends. Let's get to know about why people do not get babies because of hormones. You go to a doctor tells you have hormonal imbalance. That's why you are bleeding and you are not conceiving. When the egg, the zygote, the sperm and the ova are fused and it is implanted. You see? So let's get going. So what can happen if you have low estrogen? Because we have said the functions of estrogen in a woman is to regulate menstrual cycle, thickening of the endometrium, support the reproductive organs of a woman to perform the way they are supposed to perform. So low estrogen will make your vaginal area to be dry. Women that are always dry are suffering from low estrogen, because estrogen is the one which supports the reproductive organs. Irregular periods and infertility, that is low estrogen. High estrogen will make you have heavy bleeding, making menses come twice in a week. In a month you get like 3 times, fibroids, you start having some myomas, muscles that are coming out like protruding. Those are fibroids because of the high estrogen. People with fibroids will always see them having high estrogen. Ovulation suppression. So if you have high estrogen, you see, luteus, the corpus luteum produces progesterone. Luteinizing hormone helps to maintain and produce progesterone. But estrogen is the opposite. Heavy bleeding, fibroids, and ovulation suppression. So progesterone is the opposite of estrogen. Guys, if you have a question about infertility or any other thing that you've been thinking of, ask at the chat. Bring it at the chat. Today I can see my ladies are in the house. I know they have undergone so many things in life about bleeding every time. Let's talk about them. Let's talk about these issues. Let's communicate. Let's help our daughters that are growing. So progesterone, I can see Marjay in the house. Marjay, big up Marjay, big up every time Marjay. I can see you chilling in the house. Welcome. We are talking about hormone imbalance and infertility issues. Progesterone is produced after ovulation. Just when you have ovulated, the egg has come out, progesterone starts to rise. Do you know why? It's because when progesterone starts to rise, it means the egg is going through the fallopian tube, ready to meet the king here, ready to meet the king. The king is the sperm. They fuse, they form a zygote that comes to form a blastocyst that gets into the wall of your uterus. The blastocyst forming in the walls of your uterus. And it needs what? It needs more progesterone. It needs progesterone to keep these walls thick and maintain the pregnancy. You see, so progesterone comes immediately after ovulation. What causes them to have an ectopic pregnancy? Yes, ectopic pregnancy. That is from Stan's Kitchen. Ectopic pregnancy, the pregnancy is growing at the fallopian tubes. So what can cause it? One, it can cause it like this, because when the sperms flow, they come and meet here. So it means from here to here, it takes 6 days. It means that there is something that is blocking this zygote from coming to the uterus. One is fallopian tube problems of thickness. Second, maybe there is very many thick fluids that are here that are blocking this zygote to come to the uterus. Flow, swimming, you see, because when they have fused and they have formed the zygote, they are supposed to come, the blastocysts to come to be implanted here. So thick fluids, closed fallopian tubes of infections, you know, can cause that. You see, those are the questions we need to ask. What are the causes? Many people that are used to after morning pill, you take it, so today, after a week you take it, it makes you have more progesterone. And you know, when you have more progesterone, so this one becomes thick, the walls become thick, and the vaginal fluids more and thick become, so they block the fallopian tubes, and you already had sex and the zygote has already formed. So before 6 days come so that it can be implanted, it is blocked here. And that is the way people get, after you take after morning pill, you find that you are pregnant and it is fallopian tube pregnancy, which is ectopic pregnancy. That is what happens. See? Thanks for asking that, Stan's Kitchen. Thanks for asking that question. So let's get to go. Progesterone. We are in progesterone. Produced after ovulation. Prepares the uterine for implantation. Makes the uterus walls thick and maintains early pregnancies. Yes? Because if you have been implanted and there is no progesterone, you may have an abortion, because the wall becomes slightly thin and the zygote may flow off, and that is an abortion. See? Hope I'm getting slowly and clear. Those people that asked for this topic will appreciate. And if there is nowhere you are understanding, ask. Let's interact. Let's get to know what happens inside there. So, what can have when you have low progesterone? You will have difficulty in maintaining pregnancy. Every time you conceive, it's an abortion. Every time you conceive, it gets out because there is no uterus that can hold it. Check it. Now you understand what hormonal imbalances are. There are some things. Low progesterone, women, early miscarriages, because if progesterone is making this uterus wall to become thick so that they can hold the zygote, it means if you don't have enough progesterone, what will happen? What will happen is it will be thin and it will not be able to carry that zygote, meaning it will come out anytime. You see how things are? Luteal phase. affects the phase after ovulation, corpus luteum, and you see, it makes it having defects. You are welcome, doctor. Can the situation be identified and taken care of when a couple get married to take care of the liquid? Yes, it can. By you, people that have Stan's Kitchen, people that have menses that are always on and off. If you are married at an early age, 25, 26, 27, 30, 35, and you are seeing your menses sometimes take long before they come, sometimes you stay 2 months, you haven't seen menses, and you are not using family planning. Muriet, hello everyone. Muriet, welcome to the platform. If you lay down for some time, it will help. Oh, okay. That is another way, maybe. Betty has told us. But irregular menses, if you have them, what will happen? Check. It's very important to check by the doctor. Go and do something that is called hormonal profiling. Levels of progesterone, estrogen, hormonal levels. Go and check them, so that the doctor can tell you, now this is the way for you not to get ectopic pregnancy. Try this and this. It is done. Just take your blood, take the blood too. Yes, people have very irregular menses. Great advice. Yes, for people that you have irregular menses, please go to the doctors. Let us find the what? Let us find your what? Hormonal profiling, so that we can know before you get married, you don't get yourself with difficulty in maintaining pregnancy. Things that we call cervical incontinence, uterine incontinence. No, we want to see that. Women. So girls, let me call you girls today. Ladies, girls, ask those questions. Let them come. Let's educate everyone. You know, even our grandmothers had their ways of doing things. When there was a problem. When there was a problem, like miscarriages, they had their way. If there was a problem with infertility in the society, we had our grandmothers who were specialists. So give me those things. Let's interact and let's talk. I can see today it's Margie only. The others are men. Maybe they are listening behind the curtains and they don't want to say something. So if you are a man and you are here, don't feel ashamed of asking. You may be asking for your niece, for your wife, for your person, for your relative. You see, ask that question. Muriet, long time. How are you doing? That is from Stan's Kitchen. Now, prolactin, hormone for production of milk. Milk production. High prolactin is called hyperprolactinemia. Oh, Margie, okay. I always thought, but it's okay. You know, we don't see your pictures. So today the house is full of women, and that is great because it is their topic. It's their topic. So welcome, Margie from Jamaica. I thank you for telling me that. All along, I've been thinking the opposite, but now I know. I wish you had your profile picture. I would see. So let's go on. Let the questions flow. Let's interact. Let's feel the vibe. You see, we are on prolactin, hyperprolactinemia. Hyperprolactinemia causes missed periods because you know some women, when they have given birth, they can't conceive because that is we call it lactation amenorrhea, lack of your menses because of high prolactinemia. For the men themselves, significant other to women. For the men themselves, significant others to the women. My niece have the problem from in her teen, so he was diagnosed with polycystic ovarian syndrome. Margie, did they do something like progesterone levels? Check if they did progesterone levels. Polycystic ovarian syndrome with progesterone sometimes are very close. So when you have missed periods, you know, when a woman is breastfeeding, there is high prolactin because of milk. So it makes you not to have menses, missed periods. Not sure, doc, but I will ask. Please ask, because if you have high polycystic PCOS, polycystic ovarian syndrome, you will find some problems when it comes to high progesterone. And when you bring down the progesterone, you find these PCOs are going away. You know, please find out, help that needs. And when this prolactin is high, do you know what happens to women? They have low. Yes, very true. They have low libido. Women that are breastfeeding have low libido. They have low libido. Women that are breastfeeding have high prolactin. So libido is a bit down. So if a woman is breastfeeding, some men feel bad when they are married because this woman doesn't want other things because the libido is down. Remember, this woman is breastfeeding and prolactin is high, that produces milk, and that's why sometimes they don't get menses. So let's go to thyroid hormone, T3, T4 and TSH. Thyroid stimulating hormone, T4 and T3. T4 and T3. T3 is the active one. T4 is the one that is produced from TSH stimulated. Thyroid hormones, she gained a lot of weight within 1 year. Yes, that was progesterone. Imagine people having progesterone and high estrogen and progesterone levels that are high. The weight gain, especially women, if your estrogen is high, you may have polycystic ovarian syndrome and you'll gain weight. And if you look at that woman's pelvic region at the waist, you'll find it is, they have bigger waist and shape that is big when you have high estrogen. You see, so weight gain is there. Thyroid stimulating hormone. Thyroid stimulating hormone affects fertility, both hypothyroidism and hyperthyroidism. And when you have hypo or hypothyroidism is when you have production of low T3 and T4. And hyperthyroidism is when you have a lot of T3. You see, and there is one that is TSH production. That one, thyroid stimulating hormone, is produced from the brain, and then it stimulates the thyroid to produce T4. When T4 is produced from the thyroid, the free one which is in the blood is called T3. The free is activated in the blood according to your needs to produce T3, which is the active one. So if it is produced a lot, you see, if it is produced a lot, thank you so much, see you soon, welcome. You will see this person has irregular menses. This person will have miscarriages. This person will have infertility and poor fetal development. That is in women. You see how we are going step by step. In women, we have gone all through the normal hormones that a woman should be having. In males, let's talk in males. I have not seen any male here today. Is any male around? If you are watching me and you are a male, please say hi. We see you. Or are you afraid to talk about these issues? Are you afraid? You know, when it comes to matters fertility, you don't tell a man that you cannot, you don't. That is the highest level of abuse. Even if a man cannot, please don't. A man will not take it. But with women, sometimes they take it and they agree. I don't know why men are so hard to accept when they have these things. Hi, Dr. Benjamin. Greetings, my bro. Elmari, greetings. How are you doing? Men cannot afford to relate to themselves that their libido is down and they are infertile. But these are things that we talk about. Let's talk about them. Let's talk about males. Now, we have talked about women and let's talk about men. What about men? Testosterone. Men always blaming the women. Yeah, all through. Even if the man has the problem, you'll see the man taking the woman to hospitals. Sometimes as a doctor, you remain in your office and you start laughing yourself. You start laughing yourself because of what you are saying. A man is bringing a woman in a hospital who is very okay, doesn't have any problem. Every hormone is balanced, but he's still blaming the woman. This woman is not giving birth. And the man himself, when you tell the man, now let's get your sperms and some blood, we see what is happening. The man will tell you, according to the culture, I am okay. Always blaming. Let's see what happens in a man. Testosterone levels. Main male reproductive hormone is testosterone. Its function, it helps in sperm production, libido, and erectile dysfunction. When a woman when a man has low testosterone, what happens? Reduced sperm count that cannot even fertilize. Erectile dysfunction. You are with your man there, feeling very hot, ready to eat your cassava, but this man cannot cook your cassava well. Just imagine testosterone, this hormone. Fatigue. Some men are just fatigued. They don't have energy. Because this hormone is the one which gives men muscles to work. Same so. Okay. Betis 1876 says so. Reduced muscles mass. Testosterone is the one which makes a man talk like a man, like I am Dr. Benjamin. You feel me? I am a man. But if there is no testosterone, I'll be talking like I am Dr. Benjamin. You understand me? You get that? So that is testosterone. Let's talk about another thing, which is hope I'm not hurting anyone. I'm just giving some medical tips. So don't feel bad if it is happening to you. Let's get some help. DM me privately, you get me? Now Betty and Margie are laughing. They are feeling nice when I'm talking like a woman. Yes, you see? Even men have follicle stimulating hormone. Imagine even men have follicle stimulating hormone. Follicle stimulating hormone. Today I'm talking silently and calmly. I don't want anyone to feel irritated, agitated, or hurt. That's why today I'm talking like a gentleman. No laughing. Follicle stimulating hormone, even men have it, not only the women. Even men have estrogen, but at low levels. So it stimulates sperm production, follicle stimulating hormone. If it is low, you will get poor sperm production. High follicle stimulating hormone gives testicular damage or failure. See, even men have hormones that women have. Let's talk of luteinizing hormone in men. What does it do? Stimulates testosterone production. The testosterone production, which helps to be a man. They just have to face the facts and get help. You see, Marjay B says they just have to face the facts, which is true. And that's why today I'm not saying, if there is a man, I'm still saying, if there is a man today on the platform, please come out, tell us I'm here listening. No, man, no. Men fear fertility issues. That's it for yourself. Never, I'm still repeating. If you want to bring down a man, just tell a man that you are infertile and low libido issues you have, and you are not a man. Finished. Men have prolactin, just like women that give them lib. High prolactin men, it shall be low, causes low testosterone, causes low libido, causes erectile dysfunction and reduced sperm count. This is the only hormone that makes men to start having things like looking like a woman. Some men don't have beards. Some men talk like women. Some men cannot satisfy their women. Some men are infertile, low sperm production. Why? Because they have high prolactin hormone. That one should be in women at the time of breastfeeding, not in a man. But you will find men have it at low. So when a man is having a sperm production but less, at the bed only eats half a cassava and sleeps till tomorrow, the first thing you should see a doctor to see what is happening is prolactin levels in the blood. Very important. Very important. Now, what are the causes of hormonal imbalance affecting fertility? We have seen one of for friends here have said polycystic ovary syndrome. Most common hormonal causes of female infertility. Most female who have these problems, they are infertile. It causes irregular periods, excess androgen hormones, cortisols, multiple ovarian cysts in the, acne. You'll find these women having a lot of acne, boils, the face, weight gain, big, because of more progesterone and excess facial hair. You have seen some women have hair up to these places, at the face, more hair. Ovulation becomes irregular or absent. You see, that is one cause of hormonal imbalance. The normal balance of hormones is disturbed. See that? Are we understanding, my friends? My friends, are we appreciating the talk? If you are appreciating, say yes. Tell your friend who has been suffering from getting a child to watch this video and start answering him or herself. Yes? What about the one who realized sperm blood? What about the one who realized sperm blood? Please paraphrase that question so that I can understand it and answer it diligently. That is Muriet. Who realizes has no sperm, or what about blood? Please paraphrase it so that I can answer it very well. Thyroid disorders. Thyroid they cause high prolactin levels, irregular ovulation, and miscarriages. And you've seen what prolactin can do. Prolactin makes in women to have milk in the breast, menses that are not there. Hi Habs, I can see Habs is here. Welcome Habs, like that. Thank you. Today is the day of my ladies. You see, my ladies. All the ladies are in the house, and man, they look at the title and say, "No, I cannot go there." And you see, I've asked for men for how many times? When we meet our men tomorrow, let us laugh at them. When we meet our men tomorrow at my talk at 4:30, I know they will be there. Let us talk to them. You see, it is almost 1 hour. No man has come in. Or they have been watching and dropping without commenting. Man, what is the problem with our men? So, Muriet, please paraphrase that question. I would like to answer it diligently. What about the one who realized sperm and blood? Okay, I really want to know what it was she was asking. Okay, let's continue, my friends, my dear lovely ladies. Yes, today we are talking slowly. Yes, someone may say today I'm in a drama festival producing a choral verse. Now, hypothyroidism. When your T3 levels are down, T3, you'll produce high prolactin, irregular ovulation, and miscarriages. And menses sometimes may not be there. They may not be there. You see, if it is hyperthyroid, you have high T3 and T4, you will have disturbed menses. And for men, they will have reduced sperm quality. You see, even the thyroid has a giving in this hormonal imbalances. Let's talk of blood in semen. Oh, that is a problem. Blood in semen means the scrotum, the vas deferens, the tube that brings sperm, or there is something that like a tumor that is in the scrotum. So when a person is ejaculating, it is ejaculating sperm. Let me talk about those conditions when I'm ending. And if you have sperm in semen, you really need to talk to your husband, your boyfriend, or your person to go and to be screened the prostate. Because when the prostate are constricting, that is where the sperm jacks out. So they may be constricting a lot until they come out with blood. We talked about this when we are talking about prostate complications. So the first thing you should do is do urinalysis to check infection. Second, do prostate cancer check. Do prostate PSA, prostate specific antigen levels, and do check an ultrasound, the ultrasound sonography, to check if it is swollen or okay. Those are things you should check. It should be a problem. You should not have blood in semen or in sperms. Yes, there are other conditions like pituitary disorder, rain at the pituitary level that produces gonadotropin hormone that regulates follicle stimulating hormone and luteinizing hormone. Pituitary gland controls many reproductive hormones like prolactinoma, hypopituitary. You see, effects are stimulation, reduced sperm formation. You see that? There are some cases where we have lifestyle. Lifestyle is a factor. Obesity, big body, and obese person. Fat tissues affects estrogen and insulin balance. How does it come in? Anovulation, no ovulation, reduced testosterone in men, and poor sperm quality. So you should not be eating and staying there. Eat, walk, like Barry walking exercise. Let's walk, guys. Let's walk. Let's do exercise. You check out that. Hope I'm being clear and everyone is understanding. If you have a question, drop the question to the chat. Let me answer you. Let me unlock your mysteries that you've been thinking. Why is my niece not getting a baby, and they were just married sometimes ago, like 1 year ago? Some things are hormones, and if they are balanced, someone can get a child. Extreme weight loss on malnutrition. Someone is married and from their home they are eating well and is getting into a relationship and marriage which is not okay. She doesn't want to speak out. You just see your lady or your girl is always thinking, stressed, but he doesn't want to open up to you. What does this see? Seen in eating disorders, excessive exercise, and severe illnesses and stress can lead to amenorrhea. Menses between menses and heavy menses. Infertility issues. Stress is a key factor when it comes to hormones and reproduction. When you want to get a baby, making a baby is a good thing. It should be a wonderful thing. You make babies by feeling good, but if you make babies by being stressed, you will never get them. Why? Stress is a factor. And why? Chronic stress increases. Remember what we said, cortisol. And cortisol suppresses reproductive hormones. Now, if you are stressed up, it suppresses gonadotropin releasing hormone, and it will not control the follicle stimulating hormone and luteinizing hormone from the brain, pituitary gland. So you will have delayed ovulation and reduced libido, stress. And that's why when people are stressed, you will hear them say, I don't feeling like having sex, I don't feel like making love, because cortisol is released and the pleasure hormones are not there. It's masking the pleasure hormones. Check out, my people. Another thing is people that have diabetes and insulin resistance. If you have diabetes and you are always feeling, men, erectile dysfunction, testosterone levels low, and ovulation, and people that have polycystic ovarian, PCOS, polycystic ovarian syndrome, if you are diabetic, you have high chances of getting polycystic ovarian syndrome. So, Marge, check on HbA1c on your niece. Check if the last 6 months your niece has been having stable what? Sugar levels. If she's Queen today, welcome. Hello doctor, good to see you today. I'm very fine, Queen. And today I'm a little bit worried that our men have not come in. Our men are hiding in the bushes. Let me check. If you are a man, please say hi to the chat. No man says hi, because this one is a topic that makes men freak out. I don't know why. I don't know why men fear this topic. Those guys that are married or you have boyfriends here, please tell me why men fear this topic. So we are continuing good and cool, almost 1 hour, and we are giving the facts. We are getting the facts, my friend, and someone is answering herself. Because now I really know if there is a man who is watching, that man cannot comment anything. We need to talk to men to start accepting health problems and be ready to be helped, right? I think that is the way to go. So tomorrow when you come at 16:30, and the first thing we will do is to laugh to all men that will be there and tell them, why did you avoid this topic? Why did they avoid this topic? Why are they flowing in the bushes right now? Even Onik, even Xavier man. Hey, my men are letting me down today. Let's see one man that will come up and text something before we end. Let's see. Guys, talk to our men. Talk to men. I'm still saying, please talk to men. Let's go to aging. When you are aging, a woman, egg reserves and estrogen decline with age. So if estrogen declines in age and egg reserves are declining, the follicles wither, because estrogen keeps the follicle. The follicle wither. So you can not be able to bear a child normal way, but you can bear a child by artificial insemination. You can carry a child by artificial insemination. You get an egg from someone and sperm from your husband, and then they are inseminated in your uterus, and then you carry your baby. The fact about an aged woman using her egg in artificial insemination, the baby may have slow developmental miles. The baby may have slow developmental miles, because you see, men, knowledge is power. Yes, knowledge is power. Tell them. So because the sperm, the egg, it is like depends on estrogen to be healthy. Estrogen is like fertilizer to them. But you see, as you age, estrogen goes down. So the fertilizer is not there. You produce weak what? You produce weak eggs. And with weak eggs, what happens? Complications of the baby can happen. So my guys, let's tell our girls to try and get babies between the ages of 25 to 33 or 35. So that we have healthy babies with good IQ. But if you are seeking for a baby after that, you can do an artificial insemination and carry your own baby as a lady. So in men, testosterone and sperm quality gradually declines. When a man ages, the testosterone levels come down and sperm quality decline. But you know, for men, even if they age, some of them will always have the libido. But the sperm quality that is coming out may be not the one that is. See? Now, let's talk about symptoms of hormonal imbalance related to fertility. We start with women, because our men have let us down and they are not here. Today they have said that topic, it does not belong to us. Let's just peep, watch and not comment, run away. Run away. Symptoms of related infertility, hormonal imbalance infertility. Maybe Onik is busy. Onik wants to marry our sister Miss Marie. Savior man told me that, falling in love is a good thing, and when you are single and love is a beautiful thing, my friends. Love is a beautiful thing because it hits your eyes and confuses your brain, and the reaction becomes a little bit of psychosis. Yeah. You can't imagine at your age or my age doing what I was doing when I was busy telling my wife, I wanna be your number one. I can't imagine me doing those stuff right now, Love, my friends, what love can do to a person is complications. It gives you a picture in your eyes, it sends the code to your brain. Dopamine at the prefrontal cortex comes out, disturbs your brain, and then you become a little bit of psychotic. So you start doing things that Yes, let's continue with our topic. That was by the way. In women, they have irregular periods. No periods at all. Amenorrhea. Hormones, those hormones that you've seen, women will have amenorrhea. No periods at all. Heavy bleeding. You have seen when you have high estrogen, you start having heavy bleeding. Prolactin, high prolactin. You have acne, excess hair growth, weight changes. My co-worker is 28 and she did IF. The baby is now 4 years. You see, maybe she had some issues with getting at 28 is still young. The normal way can work, but maybe she had a problem and it's okay. Doing it to get what you want. It's okay, my friend. Difficulty in conceiving and recurrent miscarriages. In men, they will have erectile dysfunction, low libido, reduced facial hair. When you have low testosterone, reduced facial hair. Thanks for those likes, my friend. Thanks for those likes. And I'm always saying that for those, I usually see people sharing out my channel. For everyone that is sharing, I thank you so much for what you are doing. Because I usually see someone coming in and texting, I'm from this platform and I was shared from this platform. I like your work. It gives me motivation to continue. And I thank God for this platform because it is making me to connect and to know many friends and relate to many friends. Social stores become bigger. Because maybe one day I can drop in Jamaica, for which I want to visit Jamaica next year. And then I'm walking by myself in the streets, and Betty sees me walking, and someone who he knows wants to harass me. Betty will tell that person, I know this guy, this is my friend, stop doing what you are doing. That is called social banks. So let's continue about our topic. Today I'm talking slowly and majestically so that people can understand. Now, in men, there is erectile dysfunction, low libido, reduced facial hair, breast enlargement, and low sperm count and fatigue. That one we had talked about. What can you investigate when you have these signs? What you can investigate is simple. Those hormones that we have talked about, to check which one is bringing crisis and is bringing other things to change. prolactin, thyroid stimulating hormone, testosterone, luteinizing hormone, follicle stimulating hormone, gonadotropin hormone, all of them. Her ovaries were damaged. Oh, okay, sorry for her. But thank God we have technology. Now she'll have a baby. Now she'll have a baby. See, girls, today I'm calling you girls because it's our topic. Girls, you see? You remember that time you were called, hi girl, how did you feel? The person that you loved, and then the first time he told you, hi girl, can I get your number? Or millennials never talked about numbers. How were we connecting when we started dating? In the market days, visiting days, how, technology has made so many things easy. Like when you meet a lady, the first thing you tell this lady is, you look good. I'd like to talk to you a bit. A gentleman, I'd like to talk to you a bit. Yes, of course you can. And then you start from the bushes. You look elegant. You're talking nicely. I love your perfume. And your physique is appealing. Can I take a walk and locomote around this street slowly by slowly with you as we interact? Because my heart is pumping so hard, it needs to be relieved. Can I have your number? The number is that optimum point, because after the number you can call, you can text what you have. But how are we communicating with? How? Man, those days. Miriam, hi. Welcome, Miriam Mumbwa. How are we getting into that session, We were meeting in the markets. We were meeting in schools. Writing letters. Taking 6 months to get there so that it can be read and replied to. I think those are the facts that are making the millennials' relationships have been stronger than the current relationships, because you were patiently waiting for a letter that you've written, and you can wait for the letter for 2 months just to get an answer from a lady. Waiting for you patiently. Girl, I'm happy that you're mine. You imagine? You wait for a letter for 2 months. But nowadays, before you wait for a letter for 2-3 months, someone has already given you an insight. You will not, this relationship will not work. This lady, ABCD, this man, ABCD. Then you choose, and if all those insights you have been given, you give up early. But nowadays, can I have your number? You are appealing to my eyes. Your physique is confusing my eyes. Let me meet you for supper or for lunch. Because you can call this evening, you can text. Things are easy and fast. So without even knowing someone, you are in a date today evening. Tomorrow you are in a bus or in a car heading to my place because of the quicker way of getting things, and that's why we have too many divorces than before. And that's why we have many people hurting everyone than before. Doing things in a hurried way. Quick, I love you. In a phone in the evening, you text. Very faster fixing things. You feel that you are, I'm single and you need someone. You just met in town while you are walking. A phone call away, can you come? Because you are single, you go. But previously you had to wait for a letter, and you wait to ask the parents the permission, and you had to be very secretive to who you are dating, because if your parents would know, hey, Hey, me, I remember one time, I said hi to a lady and the lady came home. Hey, and found my mother outside. And my mother was fire. You can imagine, I'm stranded in Asia trying to sing for donations on live streams. Minds and yours, please allow me to sing for you live. Please help. I am hungry from New York City. I'm in Asia. I can show. How can you show in our chats? Can you how to spell Mark? How to spell Mark? How can you show us? Please try and show us so that we can know, and how can we help you? So that was by the way, my friends. You can imagine. Imagine what went on. Me seeing a lady has come home. I'm still young. The lady has gone to the living room. My mother, who was seated out basking, has led the lady to the living room. Where. I felt like the world can open and swallow me that day. Eesh. Let's continue about infertility issues. Infertility issues are imaging. What can you do when it comes to imaging? You can do a pelvic ultrasound, follicle tracking to see if there is blocked fallopian tubes because of thick progesterone. How to spell Mark? Subscribe to my channel and text me on one of the videos. I want to see if you are really stranded. Ovulation assessment. Basal body temperature, because if you continue taking your temperatures for 14 days, you will notice that there is a time where your temperatures are so high and your body is on hot because you are ovulating. But all the temperatures, if they are straight, it means you have a problem. And you check the progesterone level, because after the egg has been released, it is ovulatory time, your progesterones are high. So that is the time you check. Today, I am giving you stories very calmly, and you are listening very calmly, enjoying. Say something, my friends. Let me not just talk to myself. If you are new in the platform, don't just listen. Tell us something. So for the male, you can do sperm count, motility, how they flow, because you can have sperms that cannot swim. That will be a problem. They will not go up to the fallopian tube. They'll just get here and stuck here. And it has to come up to this side so that they can fuse and go back to be implanted. You see, we have hormonal tests like testosterone, follicle stimulating hormone, and prolactin tests that we can do. Those are very important tests. Now, treatment of hormonal infertility include lifestyle management, very important. Lifestyle management, very important. Includes weight reduction in obese, balanced diet, stress reduction, sleep improvement, and avoid smoking and alcohol. Always. Medical treatment. We have letrozole and clomiphene citrate, which stimulates the ovulation. Treating thyroid disease, hypothyroidism, we use levothyroxine that helps to stimulate T3 to come up. Hyperthyroidism, we use anti-thyroid like carbimazole, the carbimazoles, metimazoles, those ones. Lowering prolactin, that is cabergoline or bromocriptine. So women who want to stop breastfeeding, they use bromocriptine, because they want prolactin to stop bringing out more milk. Insulin resistant treatment like metformin use helpful in PCOS, ovarian cyst, polycystic cysts are pockets of fluids that are filled inside the ovaries. It's not a complicated thing, so you can use metformin. Testosterone in men, treat depends on the cause. If it is the prostate having a problem, you treat it. Assisted reproductive like ovulation induction, intrauterine insemination, we have talked, and one of us, Marjay, has told us one of the friends did it. In vitro fertilization, intracytoplasmic sperm injection, all those. A woman can be injected with your sperm so that you get fertilized in the here. A woman can, if you are having sex with your man and they cannot flow, it can be induced so that fertilization can occur. Prevention of fertility support, healthy body, exercise moderately, treat thyroid diseases, you've seen, control diabetes, avoid alcohol and steroids, avoid smoking and drugs, manage stress. Seek medical evaluation early in pregnancy delays if pregnancy delays. When to seek medical help? When? No pregnancy for at least 12 months. Recurrent miscarriages. The coffee cakes, high coffee cakes. We are talking about fertility issues. Very painful periods. Signs of excessive hormones like hair growth, acne, and discharge. Hair growth, acne, and discharges. You see, those are signs that you can look at and say that these are the problems. Women above 35 years should seek evaluation after 6 months of trying to conceive. So that is about fertility issues. I don't know if I've left out anything. So today I've told you today has been a day for our ladies, and you have testified. For 1.5 hours that I've been talking, no man has texted anything. No man has texted anything. And you have seen, this is a problem, and we should check it out. We should check it out, and we should help our men. We should help our men. So anyone who has not understood anywhere, or anyone who has a question, here is a time of question. So I've talked about how hormonal imbalance affect fertility, and you have seen how hormonal imbalance affect fertility. So anyone who has a question, I can see the coffee cakes is coming in. She has been listening and she's smiling in a good way. Anyone who is coming in or has a question, please, I'm here to listen to you. Or anyone who can add anything, please ask. I'm waiting. I have 7 minutes to go. I have 7 minutes to go. So my guys, it's your chance. My ladies who are watching, my ladies, it's your chance to ask Dr. Ben a question, or even say the topic has been delivered so well. You see, and even say the topic has been delivered so well. So my people, I'm waiting for your question. 7 minutes to go. Anyone who has anything to talk about, to say, please, I'm here listening. I'm here listening. I'm here listening. I want to listen to your questions. Or no questions today. Everyone has learned so well. If you have a question, just ask. I have now 6 minutes to go. 6 minutes to go, and I'm giving anyone a chance to what is happening? Anyone who has a question, Maje, Coffee Cakes is laughing. Why is Coffee Cakes laughing? The topic has been so nice. Nene and Mom. Nene is coming when we are just finishing. We will deal with them tomorrow, Doc. My ladies, please make sure tomorrow at 16:30 you are there. We want to make these men know that men, these problems of fertility are not for men. For FRC, you are here. We want to make men to know that these problems are not for women alone. You see, we want to make them understand these problems are not for women. Sorry on the road, it's okay. FRC, imagine since we started, with all the people that we have had, there is no man, even one, has said something. FRC, imagine. Nene, just imagine, the men have gone into hiding. This topic seems to be so hard on men. It seems this topic is a very hard topic. How can we help our men? You see, now that is another topic now. How can we help our men how can we help our men to accept that these are problems that we have and we need to help each other? Check on the chat. The men were just sitting behind the grounds and no interaction. Where today is that day. The doctor, can the cyst break off by medication and release? Yes, sometimes they reduce by medication, the cyst. There are some medications you can give and they reduce, and there are some medications also that can make a person, a cyst. A cyst is just a pouch filled with some thick fluids from the body. So these fluids, when they are not movable, they form a thick pouch. You see. So there are some meds a person can be given, but if it is big and it is bringing problems, what we do is surgical removal, and we cut that pouch out. So that can happen. It can happen. But today I'm surprised how our men, how our men are afraid of this topic. Well, no man. And the way we sing, no man is an island, no man stands alone. Men should eat more raw cassavas. Hey, Everest, raw cassavas, what do they do?
How are you? How is your night? Yeah. How is you? What about yourself?
What do raw cassavas do?
Thank you so much for getting this. What you remember?
It makes a man have more sperms.
That's what you're getting here.
Or
it's 10. Almost 10, or it's 10,
or it makes a man have. So 2 minutes to go, my friends. 2 minutes to go.
And it's only 5 minutes since the game started.
And there's something that I want to say again. Social factors can make someone not to get help. Social factors can make someone not to get help. Because right now you have seen, there is no man that has texted and said and asked or even texted something. That means it is social factor. The social factors have made men to be afraid to speak out when there are problems. And even some women to speak out some of the problems. And that's why you will see men suffering in silence. It's not that they cannot, but they are afraid to come out and say, I cannot do this. I cannot make a woman conceive. I am having erectile dysfunction. That thing of being a man should be on top of everything. It is making problems in relationships, and you have seen yourself. I told you up to the time that we are going to finish this talk, no man will come out, and you've seen yourself. That is how we do research, and we get statistical. You have seen for yourself. So, my friends and everyone who is watching, thanks a lot for tuning in. Everyone. So tomorrow at 16:30 normal time, I will know my men will be there. Let's meet them there and let's tell them the truth, because it is sin. You see, there is no man who has been on the chat or even said hi, but they have been watching. So this is a social factor that we should handle, you know. So guys, here in Kenya it is 10:44 p.m. at night, and wherever you are, be blessed. For those who have been watching, I think you have learned something, and experience matters. You have learned even men fear fertility issues, and even the one who said we do this topic today is a man, but that man has not come. Just speaking, saying it is a problem we know we have, but he has not come. He will rewatch or watch in silence. So bye bye, my friends. Let's meet tomorrow. Be blessed. Bye bye. See you tomorrow as we talk on another topic. The topics that you gave me are still continuing. Bye. See you.
Yes. Yeah, I used to laugh. Really.